Let's learn about the NAB standard on access, assessment, and continuity of care. Mention that organization defines and displays the services that it can provide. The elements include the services being provided are clearly defined. Defined services are prominently displayed, and the staff is oriented to these services. Then, AC point to mentions organization has a documented registration, admission, and transfer process. The process addresses registering and admitting outpatients, inpatients, and emergency patients. The process addresses mechanism for transfer or referral of patients who do not match the organizational resources. The patients cared for by the organizations undergoes an established initial assessment, for wherein the organization defines the content of the assessment for the outpatients, inpatients, and emergency patients. The organization determines who can perform the assessments. The initial assessment for inpatients is documented within 24 hours or earlier. The initial assessment of inpatients includes nursing assessment, which is done at the time of admission and documented. Then point 4 mentions about patient care is continuous and all patients cared for by the organization undergoes a regular reassessment. That is, during all the phases of care, there is a qualified individual identified as responsible for the patient care who coordinates the care in all the settings within the organization. All the patients are reassessed at appropriate intervals. Staff involved in direct clinical care document reassessment. Patients are reassessed to determine the response to treatment and to plan for the treatment or discharge. Lab services are provided as per the scope of the hospital services and lab safety requirements. Scope of the lab services are commensurate to the services provided by the organization. Procedures include guide, collection, identification, handling, safe transportation, processing, and disposal of specimens. Lab results are available within the defined time frame, and critical results are immediately to the concerned clinician or personnel. Adequately trained personnel perform, supervise, and interpret the investigations. Lab personnel are trained in the safe practices and are provided with appropriate safety equipment or devices. Lab tests are not available in the organizations are outsourced. AC-6 mentions imaging services are provided as per the scope of the hospital services and established radiation safety program. Scope of the imaging services are commensurate to the services provided by the organization. Imaging signages are provided prominently displayed in all the appropriate locations. Imaging results are available within the different time frame and critical results are intimated immediately to concerned personnel. Imaging personnel are trained in safe practices and are provided with appropriate safety equipment or devices. The organization has a defined discharge process. The process addresses discharge of all patients, including medical legal cases and patients living against medical advice. A discharge summary is given to all patients leaving the organization, including the patients who live against medical advice. Discharge summary contains the reasons, the clinical findings, investigation results, diagnosis, procedure performed, treatment given, and the patient's condition at the time of discharge. Discharge summary contains follow-up advice, medication, and other instructions in an understandable manner. Discharge summary incorporates instruction about when and how to open urgent care. In case of death, the summary of the case also includes the cause of death. To summarize about AAC standard of NABH, AAC point 1 mentions about organization defines and displays the services. AAC point 2 mentions about documented registration, admission, and transfer process. Point 3 mentions for that the care for the organization undergoes an established initial assessment. The point 4 mentions about the regular reassessment. Point 5 mentions about the laboratory services should be as per the scope. Point 6 mentions about the imaging services should be as per the scope. And point 7 mentions about the defined discharge process.